Hello everyone. So now I'm going to talk about earwax, and this is third video in the ENT series. As you all know, earwax is a very common condition, and that's why it's also very important. So earwax can literally present with any problem like any symptom of ear disease. For example, ear pain, hearing problem, ringing in the ear, chronic cough, fullness in the ear, or blockage in the ear. So whatever the patient presents with, whatever the symptom is, first of all, you are going to elaborate that symptom. So if the patient presents with ear pain, you are going to ask Socrates, that is site, onset character, radiation, aggravating factor, relieving factor, and severity of the pain. If the patient present with any other symptom other than the pain, then you are going to ask about ODPARA. That is onset, duration, intensity, progression, aggravating factor, relieving factor, and the differential diagnosis question. So first of all, as I told you in the previous video, that there are 6 cardinal symptoms of ear disease. That is ear pain, ear discharge, tinnitus, vertigo, numbness in the face, and weakness in the face. So you will ask these cardinal symptoms of ear disease. And each of these exclude some differential diagnosis. As fever and discharge are for otitis media, tinnitus, vertigo, weakness in the face, and tingling in the face, they rule out Meniere's, BPPV, acoustic neuroma, and stroke. Also labyrinthitis and vestibular neuritis. And you should ask the patient, do you feel your ear is blocked? And do you use any cotton buds? Or do you put anything in the ear to remove the wax? So if the patient says yes, then that will be positive finding for you to label it as earwax or impacted earwax, okay? All right, so there was basically your history of presenting illness. After that, you will ask about past history. Has this happened before? And if yes, how was it treated then? Okay, and past history of any other medical illness. Then you will ask about MAFTOSA, that is medication, allergy, family history, and the psychosocial of the patient. Okay, family history isn't really important here. All right, lifestyle question you can ask if you have time. They aren't really important here as well. After this, you will ask about any ideas, concerns, and expectations of the patient. And then you will go on to verbalize your examination. So you will do your vitals. You will tell the patient that I'm going to examine your ear with a special instrument called otoscope, if that's okay with you. And I'm also going to perform some hearing test on you. Regarding the management, first of all, you will explain that you have a buildup of wax in your ear, which is causing these symptoms. And the management here is really simple. So you will prescribe some olive oil drops and you will tell the patient that you have to use it 2 times a day for 1 week. Okay. So preferably in the morning and before going to sleep. And each time he puts some drops in the affected ear, he needs to keep the affected ears upward so that the drops do not fall out and become ineffective. So if the patient used it for a week and he doesn't get better, advise him to return again to the GP. Some GPs also do irrigation and microsuctioning. Okay, and if that fails, then we need to refer this patient to ENT. And you need to give the golden advice to the patient that don't put anything in the ear. Don't try to remove the wax using cotton buds because it then pushes it further inside. The earwax can clear by itself, and there is no need to put anything in the ear. Okay. So that was all about earwax, and I will see you in the next video.